For those of you who don't know me, my name is Albert Severa. I am CEO of Simbiotia, and I specialize in the transformation and humanization of healthcare centers. Join me. When I carry out a humanization project, I divide our methodology into 4 areas of work. The first is the transformation of the physical spaces. The second is how we care for people. The third is changes in the processes and technologies we use. And the fourth are the activities that are carried out within the environment. These are the activities that can be carried out within the healthcare centers that allow us to humanize and create friendlier environments with patients, companions, and for the healthcare staff. There are many activities that can be carried out in a hospital or any care center that go beyond the clinical act. They are all non-pharmacological interventions that can complement treatment in the new paradigm of person-centered hospital care. The first of these is music therapy, which can be used as a complement to treatment, but with the objective of responding to the emotional needs of the person. Music therapy is a clinical intervention applied by a professional who, through the use of music, obtains benefits for the emotional needs of the patient. The objective of music therapy in a hospital is to offer resources to improve physical condition, tolerance to pain, as well as to enhance emotional and social skills. It is a great ally to reduce stress, anxiety, and the sensation of pain that some treatments can cause. And this not only benefits patients, but also those accompanying them who spend long hours and, above all, and very necessary, the healthcare personnel. Example number 2 is clown therapy. Laughter is totally therapeutic, as many of us know, and clowns do an extraordinary job in hospitals. The goal of clown therapy is to improve the quality of life of patients, families, and professionals who spend so much time in hospitals. Clown historian John Towson calls clowns life enhancers, and for Henderson, the clown is the embodiment of hope in the face of hopelessness, and of possibility in the face of the impossible. Clown therapy has been very important in pediatric hospitals, but I advocate its expansion also in adult areas, and especially for chronic diseases and long stays. The third example is animal-assisted therapy. It is a growing field that uses dogs or other animals to help people recover from or better cope with health problems such as heart disease, cancer, and mental disorders. These activities provide comfort and recreation for residents of nursing homes. The most common you will be used to seeing are practices with dogs, but they are also done with other animals. As a very particular and really shocking case that occurs in France, where they get to enter a horse in the patient's rooms. Dr. Pello, as this horse is called, is dedicated to accompanying cancer patients in the Calais hospital in France. The fourth example is art therapy. There are emotions that are very difficult to express in words, and what art therapy tries to do is to, through the world of resources and artistic disciplines, to allow hospital patients to foster creativity and express their feelings throughout their hospitalization. Art therapy is everything that has to do with art, and the benefits are both psychological and physical. This therapy encourages motor skills to improve communication skills and develop emotional intelligence, among others. The process is based on people who, developing their creative capacity, learn to make use of their own abilities, faculties, and resources to face their problems. Its main objective is to get to know the inner world of the patients and help them to overcome the difficult situation they're going through and try to help them to come out stronger from it. In countries such as the United Kingdom, for example, it is a practice with scientific evidence that is fully integrated into the National Health Service. Let's go on to example 5, the volunteers, a key element in any healthcare center. Fortunately, society is full of people with the desire and need to help. Because although it still surprises many people, human beings are happier when we help others. As Nelson Mandela said, there can be no greater gift than giving time and energy to help others without expecting anything in return. The work of donating their time that these volunteers do is truly priceless. Through their altruism, they make the hospital a more welcoming and humane place. They can entertain patients, accompany families at times when they are most needed, welcome and orient new users of the hospital, accompany patients who are alone or need some kind of help, and thus give respite to overburdened family members. And let us move on to the 6th activity, which is that of teachers for children. One of the most important children's rights for the correct development of all their capacities is the right to education. In this case, there are teachers who teach in hospitals who play a key role in their development. These teachers have to give classes in patients' rooms or in different units such as oncology and transplantation, hematology and pediatrics. The objective of all this is that the children can complement their education while they remain in the hospital. This process ensures that they do not lose the rhythm of the classrooms and can return to school as normal. The seventh activity is the opening of the intensive care units. One of the greatest achievements is the opening of the neonatal ICU around the clock. This initiative contributes to the emotional stability of parents who can actively participate in the care of their children. Thus, instead of visiting their children at specific times or when they have to feed them, in many hospitals, parents can visit their children without time restrictions and can care for them skin to skin. In this way, what is improved is the bonding between parents and children that develops during this first time. And let's move on to the 8th, celebrity visits. I must admit that at the beginning I was not very much in favor of this type of actions, because I often perceived these actions as superficial, even not too sincere. But over time I have discovered that they can be very powerful actions if they are well studied and articulated in the right way. The idea is to take advantage of the ability to influence, not only for the people who visit, but also for their ability to generate a contagion effect. I had the pleasure of being able to chat for a while with Ana Rodriguez-Carla, who is the Director of Strategy and Corporate Social Responsibility of the Oncology Institute in a hospital, and will share with us her vision on the importance of activities in the humanization of hospitals. Do you think that activities are an important axis to humanize hospitals?
I'm sure of that. These times when you do nothing, I think that doing art therapy, music therapy, meditation, setting up activities and organizing activities for patients and family members, I think it is beneficial for them. It decreases anxiety, stress, and they are entertained. There are many hospitals that have different activities for patients, but they are individual activities, or they are somehow coordinated with some external program. It is something more institutional, not so much an initiative of professionals.
But I do think that as hospitals we should understand the need for these tools, not as just another activity, but as part of the routine program.
Do you have any testimonials or anecdotes about the importance of these activities in hospitals?
Look, we have a program in which we have different alliances with projects and we offer different activities for patients and families. One of them is music therapy, and I was very impressed in the hematology area, where a patient, her family member and daughter experienced the song with tremendous emotion because it reminded them of times gone by, very good times for sure. She was very moved, hugged her husband and daughter, and then thanked us nurses and all the professionals who were there. And the truth is that I was shocked and moved because I thought, look at what a simple song can do, the emotions that can come to the surface at any given moment. I think that in oncology patients, who are patients with a very long process, who are going to be with us for many hours, any other activity that they can do to relieve their stress and keep them busy should be complementary. The patients are sure to appreciate it.
Now, what challenges do you think this whole plan has to integrate it into the hospitals permanently?
I believe that the great challenge for hospitals is that we have to integrate it within the institution as such, and that it should have a budget or a part of the budget as other items have. I think the great challenge is that the public administration really realizes that this is also important to improve the quality of life of patients and families, and that we are responsible for it.
Where do you think hospitals should go with this issue? What is your vision?
It is clear that hospitals have to be more and more comfortable, more welcoming, more where the patient comes and feels at home. That needs to be our goal.
I hope that we will find more and more hospitals that are kinder and gentler, and despite the circumstances that we are hospitalized in, that they become places that help us to be much better. Fortunately, I am very happy because I am meeting more and more people. From hospitals who contact me to look for new formulas, new models to see how they can make this stay warmer for patients, their companions and the health personnel. There are still few of them, but it is a trend that fortunately I see is growing. And it is something that each and every one of us will benefit from sooner or later.